Hello, everybody. In this video, I am going to talk about the general requirements for writing the discussion section. We have already discussed how to write the introduction, the method, the results section, and now I'm going to talk about the discussion. And as we know, writing the discussion is one of the most difficult part of writing your article, and it is actually very important for junior researchers to know how to write their discussion. Writing the discussion part can be usually the weakest part of the article because it needs to make argument and counter arguments between your findings and the findings available in the literature published in different articles. Discussion section of your article is the place that you have to tell the readers what your findings mean. So you have already reported your findings in the results section, and now you need to explain to readers what are the meaning of these findings are. So how they can use your findings to make changes in their practice or in their research. Word count wise, the maximum number of word counts that you can use in your discussion is something about 1/3 of the total length of your article. So as most medical journals worldwide gives you 25 to 3000 uh, word count limit for writing your manuscripts, 1/3 of this word count would be something about 800 to 1,000 words for writing your discussion. So it is very important to be mindful of your limitation in writing the discussion. That's why the discussion is divided to different sections so that you can devote enough space for every section of your discussion. Normally, the structure of a standard discussion contains different sections. A section is for reporting the key or main findings, which is usually the first paragraph of your discussion, a few paragraphs to argue and counter argue of your findings with other things available in the literature, which is relation to other works. Uh, Another paragraph, one or two paragraph about the implications of your findings for clinicians and for researchers. And the penultimate paragraph of your discussion is about strength and the limitations of your study. And the final section or paragraph is related to your conclusion and your recommendations for other co-workers or other researchers working in a similar field as you. Some authorities and some experts in medical writing and publishing believe that the paragraph related to strengths and limitations of your study can be written before the section of relation to other works. They argue that when you mention your strengths and limitations of your study, um, exactly after your key findings, it gives the readers a sense to better understand your argument and counter argument when you are talking about the relation of your work to other works. While I respect these experts and I can agree with them, as most journals worldwide um, use this structure that I am showing you right now and uh, ask writers to write the strengths and limitations of their study in the penultimate paragraph of their discussion. I will follow this guideline and talk about different sections of your discussion in a way that is approved by majority of medical journals. So the first paragraph of your or your discussion is the place that you need to talk about the key or main findings of your studies. You have already mentioned your results and reported your results in the results section of your study by mentioning some numbers, some p-values, some confidence intervals, and readers are aware about those findings and results. However, in the first paragraph of your discussion, you need to summarize all those findings and excluding all numbers, all p-values, and all confidence interval from that, and write a paragraph in order to give the readers a straightforward understanding of your overall findings. So in the first paragraph of your discussion, you exclude all numbers that you mentioned already in the results. You gather and summarize all your findings in a paragraph in order to better understanding of your findings by the readers. To understand the issue better, I have selected an article recently published at the BMJ some months ago about non-invasive high-frequency oscillatory ventilation for primary respiratory support in extremely preterm infants. This study was a multi-center randomized control trial, and different sections of the discussion that I'm going to talk about have been clearly reported in this study, and this study can be a very good example that I can show you how to write different sections of your discussion. The first paragraph of their discussion, which is called the principal findings or key findings or the main findings, read as: in this multi-center randomized control trial, we found that NHFOV, or non-invasive high-frequency oscillatory ventilation, significantly reduced the need for invasive mechanical ventilation within 72 hours and within 7 days after birth compared with NCPAP, or nasal continuous positive airway pressure, when applied as the primary approach to respiratory distress syndrome in extremely preterm infants. So you can see that no numbers, no p-values, no confidence intervals are mentioned here. The authors had already reported those numbers in the results section, and they have proved their findings by using suitable statistical analysis. In this section, they summarize their findings in a paragraph and give the readers a sense of what exactly their findings were. The next section of the discussion is the section related to other works. This section can contain 2 or 3 paragraphs, and this is the place that you need to talk about the strengths and weaknesses of your study in relation to other studies. So you need to make arguments and counter arguments about what you found compared with the other results available in the literature from researchers in your field. You need to discuss the differences you found in the results, and you need to explain to the readers why you might have got different results. So it's not enough just to write that you found this, other researchers from, for example, North American found something else, or you found something else and Asian researchers found something different or similar to you. You need to explain and you need to make arguments. You need to tell the readers why you got similar results to other researchers, why you got different results from other researchers. So similarly, if we get back to the example from the articles published in the BMJ, we can read this paragraph in the section related to comparison with other studies. And in this section, the author reported that although Malakian and colleagues reported no significant reduction in intubation rate with NHFOV versus NCPAP, their study population differed critically from ours. It included more mature infants and had a smaller sample size. So while the authors of this study are explaining different results available in the literature by Malakian and colleagues, they explain why those researchers got different results from this study. They uh, discuss that report by Malikian and colleagues included mature infants, and their sample size was smaller than the sample size in the current study. Also, we can read that Klotz and colleagues in a small crossover trial of a comparable population detected no significant improvement in carbon dioxide clearance with NHFOV. However, the study was underpowered to evaluate clinical outcomes such as intubation rate. So they are reporting some differences published in some other articles, but at the same time, they explain the reason behind the differences. So when you are going to write this section of your discussion, it is very important for you to find at least 2 or 3 topics from the results that you have already reported in the results section. So one topic could be about the length of hospital stays in the 2 groups that you included in your study. Another topic can be about, for example, the mortality rate between the 2 groups. And for each of these topics, you need to specify a paragraph and write your results and start argument and counter argument with other available articles in the literature in which those researchers got different results or similar results as you, and discuss your findings with other available results in the literature. The next section of your discussion is devoted to implications for clinical and research. So you need to explain to the readers what you found, how clinicians and researchers can use your results. So you need to explain to the readers what the study means, particularly for clinicians and specifically for policymakers. But please go easy on it. I mean that when you are talking about the meaning of your study, it's very important to consider that you just have done a single study with a limited sample size. There might be other studies in other parts of the world that receive different results, so you cannot argue and you cannot claim that your results must be used by all clinicians in your field worldwide. You need to be very humble in talking about implications of your findings for clinicians and researchers. And parallel to solving some research questions in your study, there might be some unanswered research questions and some other gaps show up after performing your study. So you are doing a study, you solve a problem, you feel a gap, but at the same time, by your study, some other gaps are shown up. And it's a very good approach to write in this part of your discussion what questions remained unanswered and what can be next. This mentioning unanswered question can help future researchers, specifically junior researchers, to find gaps in the literature in this field and start doing a study to answer those research questions. This is a part that can help all researchers worldwide to be updated about the gaps that have been answered and the gaps that have not been answered, and there might be ground for future research. So again, in this report from the BMJ, you can read in this section of clinical implications that our findings corroborate and extend the conclusions of 2 recent meta-analyses and provide new insights into NHFOV's potential use in managing respiratory distress syndrome in this vulnerable population. They continue that the results advance our current understanding by showing that NHFOV is feasible and potentially advantageous as a primary respiratory treatment for extremely preterm infants. So they are very clearly expressing the clinical implications of their findings and how other clinicians can use these findings in their routine and daily practice. The next section, which is actually the penultimate paragraph of your discussion, is devoted to strength and the limitations of your study. This is a section that you need to talk about what are the unique features of your study that can differentiate your study from others. For example, if you have used a larger sample size, if you have used a longer follow-up period, if you have used a more robust methodology to answer the research question, these are some things that you can mention in the strength parts of your discussion. And as you have some strength in your study, there are some limitations, of course. So state those limitations and explain to the readers how you tried to overcome those limitations. Mentioning the limitations by you helps peer reviewer to understand the limitations and to find the answers to those limitations. Otherwise, these limitations can be asked by peer reviewers and it will take time for your article to be processed in journal offices. So in order to expedite the process of evaluating your article in most journals, I advise that be honest and write the limitations of your study and explain to the readers how you try to overcome those limitations. Again, getting back to the article published in the BMJ and the example that I shared with you, in the strength and limitations section of the discussion of this article, we can read that this study possesses several key strengths: enrollment of a large cohort of extremely preterm infants, implementation of a rigorous physiology-targeted protocol with standardized ventilatory management, and execution across an established neonatal intensive care unit network where all clinicians underwent protocol-specific training. So they are very clearly mentioning the strengths of their studies and what differentiate their studies from other available reports in the literature. They actually talk about the limitations of their study, and they have written that nevertheless several limitations should be acknowledged. Clinician masking was unfeasible owing to the inherent distinct interventions which may have introduced selection, performance, or detection bias. So they are mentioning their limitation, but at the same time, they continue that to address this, we use masked outcome assessment and adhere to predefined objective criteria. So they are mentioning that they were mindful of those limitations, and they did try to do masked outcome assessment because of these limitations. And finally, the final section or final paragraph of your discussion is your conclusion. This is a place that you need to write and explain your conclusion or recommendations to your audience. And one important thing that I would like to share with you is that your conclusion must be backed up by the data that you have already presented in the results section of your study. It is a temptation that most junior researchers would like to go beyond and conclude beyond what they found in the results section. So whatever you found in the results section should be the basis of your conclusion. Similar to this conclusion from the same example article published in the BMJ. And in this conclusion, the authors mentioned that this randomized clinical trial found that NHFOV significantly reduced the need for invasive mechanical ventilation within 72 hours and within 7 days after birth compared with NCPAP when applied as the primary approach to respiratory distress syndrome in extremely preterm infants. So they just mention the results. They don't go beyond what they found, and the conclusion is absolutely neat and acceptable for readers. So please keep this in mind, that conclude and recommend only based on the data that you have already mentioned and reported in the results section. And the final important thing that I would like to share with you is that when you are doing a research, you're receiving some positive results and some negative results. I'm going to share with you the negative results are as important as positive results, and you must report negative results similar to positive results, and please don't censor yourself. Okay, if we don't write about negative findings and if we don't publish negative findings, the literature will shortly be full of positive findings about a management strategy or about a drug. And when other researchers want to do a systematic review of, for example, this management strategy, they found some articles that are talking about positive findings, and so they report that this management strategy is good and positive, while there might be some other negative studies that have not been published. So it's very important for you to come up with a good research question and to select a robust methodology to answer that research question. If the research question is good, and if the method to answer that research question is robust enough, and with having a good and a sufficient sample size, it's not important whether you reach to a positive result or negative results. Whatever you found should be reported, and whatever you reported in the results section should be discussed in the related sections in the discussion. So thank you very much for being with us during these videos. We are looking forward for any questions, any comment. Please share your comments and questions with our colleagues at IMR Press, and share with us what other topics you would like us to prepare some videos for you, and see you in next videos. Thank you very much.